Our topic today is Miscarriages Explained, and we have 3 experts with us today. We have Dr. Haebe, who is also from the Premom team, a naturopathic doctor and specializing in hormone optimization and fertility and general wellness. We have Tina Hickman today, a women's a women's health nurse practitioner and certified nurse midwife. And she is a fertility coach at peacelovefertility.com. And finally, we have Dr. Zen, a naturopathic doctor and the founder of NMD Wellness in Scottsdale.
Hi, everyone.
All right. Couple of notes before we get started with the questions. We did get a lot of great questions from participants and community. And again, we're going to address as many as we can here. We do want to try to keep it more general. If you have specific questions, then that's a great opportunity to have a consultation with one of our specialists. You can find these ladies right in your Premom app. If you go to More and schedule a consultation, you can find them under doctors and nurse practitioners. If you do have questions, go ahead and ask them, because if you do have some time at the end, we'll try to squeeze you in. So let's jump in. And then I'm going to be quiet for a while. Let's see. Let me grab our questions. All right. These first questions are going to be for Dr. Haebe. And we're going to introduce miscarriages. Mostly, what are miscarriages and the causes? Like, what is happening in your body so that that fetus is not forming properly and is giving up that baby? Let's start with that.
Perfect. All righty. And I have the questions in front of me too, just so I'm right with you, Terry. So miscarriages obviously is something that we're looking at. It's also called spontaneous abortions, when obviously a pregnancy is non-viable, doesn't come to term, and that fetus does need to be expelled at some point. The one thing I'd like to discuss with this is that it occurs in 15 to 25% of all clinically recognized pregnancies. So it's actually much more common than people think, and we're going to discuss in just a moment why they are so common. However, I also like people to know that although they're common, which we're almost looking at like 1 in 4 pregnancies can result in a miscarriage, the likelihood of the next pregnancy being healthy is actually 76% chance. So that's really good and really encouraging, and I think an important thing to kind of remember as we're discussing this entire topic. Even after 2 miscarriages, we're looking at a 70% chance. After 3, we're kind of looking at recurrent pregnancy loss issues, which is common in 1 to 2% of the population. And sometimes those can be identifiable causes and sometimes not. We'll discuss that as well. So another question that everybody was asking is, why are they common? It's a great question. And of course, there's not a black and white answer, but I kind of want to walk you through what like the birth of a healthy baby depends on. It relies on the fertilization of an embryo, the successful implantation of that embryo, then the adaptation of the maternal physiology to accept that fetal allograft, then the ability of the mother's placenta to develop, meet the fetus's needs and physical demands, then the ability of the uterus and the cervix to hold that pregnancy, and then the appropriate growth and timing of that birth. So having a baby is nothing short of a miracle. And I kind of like to bring it back to how complex and miraculous this entire basically birth process is. So a lot has to go right for every single baby. And a lot of times this is your body's way of preventing things that shouldn't be moving forward from going forward. So in my opinion, 75% success rate is actually pretty incredible considering how complex this process truly is. Let's see. What causes your body not to recognize that the fetus is not forming correctly was the next question. Embryo can stop developing for all sorts of different issues. Hormonal levels will then tend to drop, and this triggers the body most of the time to expel this embryo. That being said, sometimes this doesn't trigger that response in the body, this expulsion. And some people will need to take medications for that. It's different for every single person. Let's see. What's the next one, Terry?
Yes, they're also wondering about the difference between like early miscarriages and then miscarriages that happen after the first trimester of pregnancy.
Perfect. Okay, so this is a really good question. So pregnancy can be divided into 3 different stages. We have the pre-embryonic, the embryonic, and the fetal. So early, you're looking at like conception to the end of week 4, and this is often a genetic issue. Same with the embryonic. So that first part, we're looking at like kind of genetic complications, and hormonally, we're looking at low progesterone. I'm sorry, guys. I'm losing my breath, and I just have Altoids today. And a lot of times with these later issues, we're looking at autoimmune causes, thrombotic causes, and anatomic causes. And kind of to wrap that up, I would say that miscarriages are most common in this beginning, the pre-embryonic and the embryonic stage. And there's commonly a genetic factor and kind of like a mismatch with that. An issue with cellular division and replication. So kind of tough stuff, but that's usually how I would say those would be divided.
Awesome. Thank you. I have to watch all that again. That was really complex. Great. We covered those.
Perfect.
Let's go on to Tina. And if we need to, we can
Excuse
me. If you have any follow-up questions. So Tina, what do we have?
Okay. So did you want to ask the question or you want me to go ahead?
Oh, let me start.
Okay.
So the next set of questions was about going further into the causes and also how prevention of miscarriage can happen. Are there some things that they can do to prevent miscarriage as much as possible?
Sure. So I'll just kind of touch on what Dr. Haebe said. It's really difficult when you go into talking about chromosomal abnormalities, but more than 50% of miscarriages are actually ending in that first trimester because of chromosomal abnormalities. So what this means is you may have an extra chromosome, you may have a deleted chromosome, and then you get into the molar pregnancies where you're actually getting 2 chromosomes from the father, and then it just, it kind of ends in what we call a chemical pregnancy. You can have a partial chemical pregnancy or partial molar where you're having, you have a little bit of chromosome from the mom, but then you're getting 2 from the dad. So again, the reason that these miscarriages are happening when you're having these genetic, alterations in chromosomes is because, as mentioned before, it's kind of your body's way of saying something is not right here. Something is not right here and we should not move forward. And then your body is actually programmed to kind of take care of those things that doesn't seem right. So that's just a little bit about pregnancy loss in the first trimester, usually almost always because of those genetic abnormalities. When you're going into the second trimester, you're looking a little bit more, not all the time, but sometimes you're looking a little bit more to more chronic problems. So you have like uncontrolled diabetes, uncontrolled blood pressure, some hormonal problems. So you're, like mentioned before, you're looking at progesterone levels, estrogen levels, any kind of vaginal infections. So things like bacterial vaginosis, chlamydia, gonorrhea, those kind of STIs, things like that. So that's all stuff you really want to get control of beforehand. So that's when preconception comes in as a preventative treatment. You really want that preconception counseling and treatment and provider care. Thyroid levels. So thyroid levels being too low, too high, a lot of times can cause that second trimester miscarriage. So in second trimester, you're looking at the genetic abnormalities and then also the chronic condition abnormalities. So a little bit onto what causes that you can do to not cause a miscarriage or to prevent a miscarriage. First of all, to make this clear, you cannot cause miscarriage by exercise, having intercourse, going to work, unless you're working in like chemical plants or something where you're exposed to exogenous things where, it's unsafe. Smoking, alcohol, illegal drugs, these are all not going to be good for pregnancy. There are some links to being underweight or being overweight in miscarriage. So definitely being at an ideal body weight is going to help, or just healthy eating habits to get you to that point. One thing I forgot to touch on that I just want to mention real quick, going back to the genetic factors, because I saw one question previously about somebody was 40, 42, something like that. So there is an increase in miscarriage risk as the age goes up. And that is because there's an increase of chromosomal abnormalities as age goes up. So if you're 35, your risk of genetic abnormalities is going to be lower, as opposed to if you're 45, your genetic abnormality risk is going to be a lot higher. So therefore, your miscarriage risk is going to be higher too. I just wanted to touch on that really briefly. So, back to the prevention. So you always want to take your prenatal, get prenatal care, preconception care, avoid smoking, illegal drugs, alcohol. You want to make sure you're getting that prenatal vitamin and taking 400 micrograms of folic acid a day. Or if you're in that age group where you're, 40, over 40, even increasing that to 800 micrograms is really good. Exercise, eat healthy, stress management, get those cortisol levels where they should be. That's really important. I'm sure Dr. Zen will touch on that. So another question that I saw on there was hot tubs, saunas, those kind of things. Does that cause miscarriage? Directly and indirectly. So the idea of that is, yes, you can take a hot bath. The idea behind temperature control is that you don't want to increase your core body temperature above what it should be. So that 98 degrees, right? You don't want to get in a hot tub or a sauna or something like that that's going to increase your core body temperature. That in turn would affect the placenta and the fetus. Let's see, you're going to want to control your chronic conditions. So as I mentioned before, your diabetes, your hypertension, your lupus, your kidney problems, anything like that. Avoid certain medications. So you're going to want to avoid NSAIDs, things like Aleve or ibuprofen, retinoids for your skin, vitamin A retinoids. And then just to touch on the chronic conditions, because I know thyroid level was possibly one of my questions. So when talking about chronic conditions and we talk about thyroid levels, normal thyroid level is 0.5 to 5. However, in my practice and in my experience, I have seen greater results at a thyroid level of 2.5 or below. So there is some experience. I do have some experience too of certain providers, when they're not aware or in the fertility world, they say, oh, well, it's in the normal range, so we don't need to do anything. But actually 2.5 or below is very, very optimal thyroid level for conception. And then let's see. Oh, caffeine. So caffeine can be linked to miscarriage as well. So they're saying any more than 8 to 12 ounces of caffeine a day can be linked to miscarriage. So you really want to control that caffeine in your diet too when you're trying to conceive, and also when you are pregnant, to kind of prevent that in the future.
And then I just wanted to chime in with the thyroid piece as well. I think you're so spot on in that, yes, it's not flagged as high or low in the range, right? But we like it in the optimal range,
Yeah.
Is what we're looking at. So spot on. That being said, also, as far as miscarriages go, making sure that you're having your antibodies tested as well, anti-thyroglobulin and anti-TPO, just to make sure that those aren't an issue. I always like to kind of let people hear those and get familiar with them, because chatting with your doctor about those, a lot of times they're not standard run. So I kind of just like to bring that up with the thyroid piece.
Yes.
You're talking about optimizing it. I'm so with you.
The other thing I would chime into with the thyroid is remember that it's normal for your thyroid function to change when you get pregnant. Now you are focusing on not just your own thyroid, but your baby's thyroid or the development of your thyroid. So that's going to create a little bit more demand. So even if you are in that normal, quote unquote, range, but you're on the higher end of normal, it's really common to quickly get outside of that normal range the minute you get pregnant. And that's why we typically shoot for that 2.5, because we know it's going to increase a little bit. But again, we can get get in that normal range and get that function being at that point. So it is normal if you're like, I got my thyroid checked before having a baby, and then now that my OBGYN is testing me, it's changing. What do I do? This can be a normal occurrence, but again, watching those antibodies, looking at all of the different aspects of how your thyroid is functioning is important.
Thank you, ladies. And we did also have a related question about progesterone and progesterone levels. Anyone want to touch on progesterone and suggestions?
Yeah, I can. So when you're first starting to get pregnant, it's kind of a unusual thing to kind of go into your provider and say, hey, I just want my progesterone level checked. You can do that. Absolutely. Get blood work for progesterone levels. Now, as far as related to miscarriage, progesterone has a lot of kind of responsibility. One of those being, we always hear about the endometrial lining and where the fetus is going to implant and kind of lay and burrow, right? So that's that endometrial lining that we want to get thick and kind of make a really cushiony bed for this baby. And that is what progesterone can do for us. So a lot of times when that progesterone level is too low, our uterine lining is going to be too thin, and then the baby just don't have a place to kind of rest its head. If you are somebody who is in fertility treatments, or, you're in the office, you're curious, you can do ultrasounds to kind of check that thickness. If you've checked the level, but you're still not sure, that thickness will show you just how thick that uterine lining is. We like to see it between 8 to 15 is about a good, healthy uterine thickness for kind of holding and supporting a healthy pregnancy. And that's why a lot of times in fertility, people who have recurrent miscarriages or are undergoing fertility treatments are given that progesterone support to kind of support that uterus going forward.
Is that pretty common then to have that be a cause? That was a question we just got. How likely is it to be a cause of miscarriage?
It is common. It can be very, very common. Not near as common as the genetic abnormalities and the other things that we discussed. But yes, it is a common problem.
And I did want to touch, we're really excited at Premom because we're actually launching our progesterone test strip. So that being said, it's only going to be positive if there's at least 5 nanograms per milliliter of progesterone present. But it's a good way to A, confirm that you did ovulate, and B, while you're pregnant, you can make sure that you're at least maintaining that level of 5 or higher, just for peace of mind as your pregnancy is ongoing. And just to piggyback on what Tina was saying, pregnancy that's not meant to be is not going to be, regardless of progesterone levels. However, if low progesterone levels are potentially the cause of that pregnancy not being able to be sustained, that corpus luteum is struggling to produce enough progesterone until that placenta can take over production, then yes, it's a great thing to have on board. So is it a problem most of the time? Not necessarily, but does bioidentical progesterone cause any harm that we see? Again, not necessarily. So if that's one little thing we can rule out, it's just a good thing to be kind of educated on and chat with your doctor about. So, but yeah, I just want to check in on those strips.
The other thing I would mention too with progesterone, because it's something that I talk about a lot with patients, is right now in the traditional world, a lot of fertility talk is really about infertility. So when things are an issue versus fertility as a preconception or preventative measure. So if something like using Premom, all of you who are using Premom, you're already like 10 steps ahead because you're already starting to give information to your doctor. So when they evaluate you, they have a better idea of what's going on. This is huge. I love that Premom allows me to have access to their information. You can share your provider login information or the code so they can see things going on. So that can be really beneficial and feel comforting so that you have the support that you need. And then also, again, doing the progesterone checks at home can be a great way to start if you've had recurrent miscarriages or have had any miscarriage. Going through one is horrible, let alone going through more than one is traumatic. And it's hard because it can feel really stressful that even if you get a positive pregnancy test, you're always kind of holding your breath. So really working with a provider who can hold your hand, support you during this time can be really helpful. I definitely am a helicopter provider. And when patients are pregnant and they've had a history of miscarriages or low progesterone. I check their progesterone in office every 2 weeks during that first 6 weeks. So it's a little bit more than the traditional, but it really depends on what you need and what support you need. Again, it's important to do the strips, or doing blood tests can be helpful. But if you're not pregnant yet and you're wanting to get pregnant, you can also get your levels checked, beforehand. So do the strips at home. Also, progesterone is like literally one of the cheapest tests to order. So talk to your provider. There's plenty of cash pay labs and options where you can actually order your own testing. But again, talk to your doctor. I think it's like a $30 test. Like, it's not very expensive. It can give you a lot of information, but it's really important to know when to test. So there's a difference between cycle day 3 testing, which is more of that follicular phase, and again, around cycle day 21, that luteal phase. That's when we're going to look at those progesterone levels. That's based on a 28-day cycle. Let's say your cycles are not regular. It's also important to kind of shoot for about 7 days post-ovulation or so. If you're not ovulating, again, talk to your doctor. It can vary depending on your specific needs, but that's the general rule where you can you want it after ovulation. That's when we're going to see that lining thicken. Pretty much every cycle, your body is getting ready for pregnancy, whether you're pregnant or not, or whether there was sperm there to cause implantation to happen, fertilization, all of those processes. But that's really important to check in that second half. So again, that's the same thing with the Premom strips. You're going to want to take it towards the end of the cycle so that you're able to see where those levels are at.
Okay, great. And actually you're next. So great transition there. We had some questions for you, Dr. Zen, about, first of all, recurrent miscarriages and including chemical pregnancies. If you're looking at recurrent miscarriages, would you include chemical pregnancies in that?
Yes. So chemical pregnancies, again, are also called like molar pregnancies or biochemical pregnancies. And that's really very early pregnancy loss. So again, it's still a pregnancy loss. So we still consider it a miscarriage. It's typically, about until about 5 weeks. After that, we consider it an actual miscarriage. But again, there's still just subcategories. So it's still considered a miscarriage. Something that was also asked was, if I've had a miscarriage, is it likely for my next one to be a miscarriage? Like, what are my chances? And as, Dr. Haebe kind of discussed in the beginning, you can have a miscarriage and then still get pregnant after. I think if you've had a miscarriage, it's important to get that additional support. Get a consultation with one of us on the Premom app. Go see your OBGYN. Get that support from the beginning so that we can monitor you. If there's things that we can prevent or, do anything in our power to help you, that's what's going to be really important. Maybe it's a little bit of progesterone and it makes all the difference, right? If we know that beforehand, we have a little bit more control and that can be helpful. But again, there can be genetic reasons, autoimmune conditions, infections. So really, if you have experienced one miscarriage, which is something that's really interesting, if you go to your traditional OBGYN, generally, they will not send you for further testing or meeting a REI, so that's a reproductive endocrinologist, until you have 2 to 3 miscarriages, which to me is way too long and way too many. So if you've had one, it's time to get that additional support. Maybe it's with one of us, maybe it is with your OBGYN. Just definitely be an advocate for your own health. Everyone's different, and it's important to kind of put yourself first. I think Premom is doing a great job of providing that information so that patients feel like they're in control, and they can share it with their doctor so their doctor has a better understanding of exactly what's going on. Remember, your traditional doctor spends anywhere between 7 to 8 minutes with you. It's a short amount of time to share a lot of information. So make sure that you come in with your questions beforehand so you can get things done and really ask everything that needs to be taken care of in that appointment. I think that can be really important as well. Something I also wanted to talk about, which is kind of an interesting one when it comes to miscarriages, is probiotics. So there was a study that showed that miscarriages have been associated with a decrease in biodiversity in the gut system, specifically a reduction in lactobacillus. And so that has been really interesting, also looking at how our gut influences our hormonal panel and how that can also affect miscarriages as well. So there are things that we could be doing today to support our body. Again, like Tina said, and Dr. Haebe about, diet, lifestyle, exercise, all of those things are really valuable. Something I also wanted to touch on was weight management. This is something that we talk about a lot, whether it's a low BMI where sometimes we're not having a cycle, and that can be an issue to get pregnant, but also in the reverse where we are noticing patients who have maybe higher BMIs, whether, weight loss would be helpful for them or not. I think it really depends on the patient, and really discussing with your doctor what that looks like is going to be important. I would strongly recommend to stay away from kind of crash diets, intermittent fasting, some of these things that can actually make our hormones worse rather than better. So being really supported during this time, so that if there is weight loss that could help, that would be something helpful. Again, with that weight loss component of it, we never want to be detoxing the body or causing, caloric restrictions when we are trying to get pregnant. So that's where meeting with a physician or a health coach or a nutritionist can be really valuable and really important, because we want to make sure that we're doing the right thing for you. I know intermittent fasting is the new trending diet. And there's a lot of benefits for diabetes and all kinds of amazing things, anti-aging and all of these amazing things. If you guys have watched any of Gwyneth Paltrow's In Goop Lab on Netflix, she talks about intermittent fasting and all of these amazing things. And there are benefits, but maybe not so much so with pregnancy or preconception. So again, making sure that there's so much on the internet right now, and it can be challenging to know what to do. And that's where sometimes having a specialist or someone who can really help guide you can make a difference. And there are things that we can kind of put in place that you can do on your own. But once we kind of figure out what's right for you, can make the biggest difference. The other question that I did get was, are there more potential risk for miscarriages as we age? And as Tina kind of mentioned earlier, yes, there is, because we're kind of worried a little bit more about egg quality. And so that's something else that we really focus on as well. So there are supplements, there are ways to live your life, focus on, your environment, things like that, that can also play a big role in your egg quality. So I think in this discussion, I think all of us can agree, it's really, there are things you can be doing today to help support your body, but sometimes you need that extra support. And having Premom is an amazing start.
Great. And we had one more question for you, Dr. Zen, about recovery after a miscarriage. Thoughts on that, how long it can take, and is bleeding and cramps normal after taking meds to speed up a miscarriage?
Yes. So unfortunately, yes, it is very common for this to happen. Of course, if you are taking medication, always consult with your doctor. Anything that you feel like is abnormal or you have a question about, don't hesitate. They are there to support you. So always ask. That's going to be my number one recommendation. The other thing is that depending on the person, patients may experience that their cycle is a little bit off after that while their hormones kind of get back into control. It really depends when the miscarriage was, how far along in the pregnancy, all of those things as well. But if it's kind of in that first trimester, we typically see the cycles get back to normal around 4 to 6 weeks later. Again, it can be very variable. I think really taking the time to own your experience, take time to heal from it, to process what happened instead of moving on to the next, I think has made a big difference for my patients. I think there is a lot of defeat that happens, and a lot of times it's very isolating. Maybe your husband is involved and understands what you're going through, but at the same time, it's very personal. So having that right support makes a big difference too.
Fantastic. Thank you. We're going to pop back to Tina really fast. Tina, I think you may have answered one of these questions. I'm not sure already. There was a question about TSH. Was that something you addressed earlier?
Yeah.
Okay.
Yeah, we addressed the thyroid.
Okay. And then also, is there an association between long cycles and miscarriage?
Yeah. So that one is a little bit of a loaded question. So I want to say, yes, there is. So there's studies that say a longer menstrual cycle leads a little bit more to miscarriage, but I kind of want to talk about that and how it happens indirectly. So bear with me a little bit on this one. So a normal pregnancy or a normal cycle length is about 25 to 35 days. Okay. So anything way less than that, anything more than that, that's when you're going to be alarming yourself that that's irregular. So I guess when I say indirectly, what I mean is we need to know what that underlying reason is for the irregular periods. So indirectly, something underlying like PCOS or thyroid disease, hypertension, indirectly something else is causing these irregular periods, which is then causing an increased risk of miscarriage. So you can take that directly or indirectly how you want, but the answer would be, in short, would be to, instead of just chalking up, oh, I'm having miscarriages because I have irregular periods, let's find out why you're having irregular periods. If we find out why you're having irregular periods and then make them in that normal range again, we can easily lower that miscarriage rate, if that makes sense.
Fantastic. Thank you.
Oh, the other thing I would quickly add on that too, if you have heavier periods too, you are more at risk of developing iron deficiency, and that too can lead to an increased risk of miscarriage. So again, getting your labs really helpful, makes a big difference.
It's really important to have as much information as possible that I'm gathering from you ladies. Okay, great. Then we had one more question. This person was saying that she's had a miscarriage, but her reproductive endocrinologist didn't do testing. OB didn't, and she's 42. Just suggestions for next steps for this person. Maybe you can find it in the Q&A.
So I would say, again, because of your age, your provider, kind of playing the advocate here, your provider is thinking genetic abnormalities, probably because of your age. It would be a little bit more specific question. We'd have to have a little bit more information as far as, do you have children already? Does your partner have children already? How did those pregnancies go? So there's a lot kind of to that recommendation. I would say if you've had a miscarriage and you're unhappy with your answer, always get a second opinion. There's never anything wrong with getting a second opinion and going to talking to somebody and say, hey, even say, my provider's on Premom said I should check this, and this, and I really want to look into my progesterone levels. I really want to look into thyroid levels. I really want to look into A, B, C. So definitely don't always take that as one answer. However, unfortunately for you, that could be your answer. Will we ever know 100%? Probably not. But going forward, I would say always advocate for yourself. And if you want another opinion and further testing, do it, and just to add on to that, if you don't want to go see a provider, there's a lot of places you can get lab work and order these tests on your own online. You get on there and you say, hey, I want to order this, and this. You add it to your cart, they send it to you, or you go to a lab, you do it. Come to us, show us your results. We'll give you the best advice we can. That's a common misconception in the fertility world is that you have to have a provider to be proactive. And that is just not true. There's so many things that you can do for yourself, going forward. Get your own lab work done, start your healthy eating. One thing I wanted to I'm kind of getting off topic, but one thing I wanted to touch on was, when she was talking about diet, it's really important to remember water. You guys, water is so important. And I know that everybody's been told this time and time and time again, but in my practice and what I have, when I've really taken it to patients and said, decrease your caffeine, decrease your sugar, increase your antioxidants, increase your water. I tell them to drink half of their body weight in ounces of water a day. This is for optimal weight loss. This is for optimal just being well. So, if you're kind of like, oh, I drink a lot of water, but I drink three bottles, right? For me, sometimes that is a lot. But half of your body weight in ounces of water is actually where you want to be for optimal healing. So there's so many things as a 42-year-old that just doesn't think genetics was your only problem that you can advocate for yourself. Start with ordering urine blood work. That's a really, really good way to start.
And that's a great transition into you ladies who are right on the app. So if you're looking for that specific advice, set up a consultation with these ladies. You can find them right in Premom. If you go to more in your app and schedule a consultation, you can find them all right there under nurse practitioners and doctors, as well as all of our fertility experts. So be sure to check it out and schedule a visit. And thank you, ladies. Do you have any final thoughts before we close up today?
I just did want to stay live. Somebody did ask when those progesterone test strips would be available, and they'll be available from us mid-December. So I typed that in the answer, but just wanted to say it out loud for anybody else that was wondering as well.
Thank you.
But thanks so much, Dr. Zen and Tina. Thank you guys so much. You're a wealth of knowledge. And I hope everyone really enjoyed this today. And we're going to keep these panels rolling with all sorts of new topics for y'all.
Yes, thank you so much, everyone. Have a wonderful day.
Thanks. Bye guys.
Thank you.
Good luck, everybody.